Thank you so much, Angela. I appreciate that. So thinking about the topics that were discussed this morning, I want to share a few thoughts about some key takeaways that I have. Coming from a nutrition perspective and the work that I do with childhood obesity prevention. So all the issues that we heard about today, housing, education, employment, healthcare inequities, they're all direct contributors to obesity, as well as the disproportionate burden this condition has in minority groups. There are a lot of factors that play into obesity, but one in particular that I want to spend some time on today is food insecurity. So I'm just going to switch over to share screen, and I think we're going to be ready to go. And so let's just talk about food security and maybe some possible solutions that might help us to alleviate this problem, which is downstream, but it's very important to pay attention to. So as you know, food insecurity is a key barrier to reducing the prevalence of obesity, and COVID has made food insecurity even more problematic, and it's widened the gap and the disparities that we see. So currently, during COVID times, we have about 12% of white individuals who are food insecure, compared to 21% of Black individuals. So some action steps to increasing food security for the long haul focus on improving the food safety net programs in the United States. Interestingly, COVID-induced changes may provide us some insights into how to remove participation barriers that many people face. So let's look at a few examples. So our first example is the SNAP program. This is the largest federal program that provides financial assistance for purchasing food, but SNAP benefits are not sufficient to cover the cost of nutritious meals in 99% of all U.S. counties. During COVID, SNAP benefits have been increased 15%, and we just saw another increase last week, and states have been given greater flexibility in managing their caseloads. So an important step is for us to, as researchers, to conduct some thoughtful evaluations of the outcomes of these emergency measures so that we have the data needed to support making these changes permanent. And then we need to communicate our support to legislators. WIC is another program in our food safety net that targets pregnant and lactating women and their kids up to age 5, but it's only reaching about 55% of those who are eligible. And it has a really steep dropout rate when kids hit their first birthday. And there are a lot of reasons that this happens, but a key one is that parents are dissatisfied with the WIC food package for kids between the ages of 1 and 4 because it presents so many barriers to the food options that parents just find them very frustrating. And another key barrier is they have to bring their kids in person twice a year for recertification. So to prevent dropouts, policy changes could require states to offer the full range of allowable healthy food options, as well as use more convenient delivery modes for those required in-person visits, such as the telehealth methods that have been implemented during COVID. Other components of the food safety net focus around schools. The National School Lunch Program, I think we're all familiar with. It's in about 95% of all schools. We certainly want to advocate for its continuation to be so widespread in its delivery, but we also need to do some work with school districts to help them remove some of the barriers that school schedules present that don't give kids enough time to sit down and eat lunch. And we also need to advocate for reducing the cost burden parents may face in paying for these meals. School breakfast program. A lot of kids miss out on this opportunity just because it's not even available in their school. So some of the action steps we can do to alleviate food insecurity is to make this program more accessible and expand it, make it free for all kids to remove the stigma that kids feel when they are participating in this particular program. And just like lunch, we need to put it during the school day so that parents don't have to face issues in getting kids to school early. Summer food program is another program that is underutilized in the United States. Before COVID in 2018-19, only about 1 in 7 eligible kids participated, mainly due to a lack of these programs, or they lack transportation to the program. So helping schools to figure out ways to open these programs and deliver foods to kids is a super important goal that we should set. COVID-related changes have allowed parents to pick up the meals that wasn't allowed before, and it's allowed them to pick up multiple days of meals. So it makes it a more viable opportunity for kids to participate, and something we should advocate for to continue after this is over. So these are just some of the examples of the federal food programs, but we also have to think about the rest of the landscape. Food retailers were mentioned earlier this morning, supermarkets. One of the areas of food retail that we really should pay attention to is the smaller outlets, the corner stores, because many people who experience food insecurity live in urban areas, many of those areas that we saw described this morning. And they may be purchasing their foods primarily from corner stores because they just don't have the transportation to get to larger supermarkets, or they may not have enough storage space in their home to accommodate more than just a few days worth of food. So I think we have to acknowledge how important these corner stores are and consider providing some incentives such as price breaks, low-cost coolers, or tax incentives so that they would offer a greater variety of perishable healthy food options beyond the minimal amount that is required to be a SNAP retailer. So it really comes down to improving food security not only contributes to preventing obesity and addressing the health disparities that we've heard about today, it has a lot of other potential payouts. And just to name a few, kids who are getting enough to eat are better able to pay attention and learn in school. Parents feel less stressed about feeding their kids and about their kids' health. Employees are healthier and have fewer sick days. So food insecurity, alleviating that can go a long way to addressing some of the disparities we heard about today.